and she will be able to answer your questions, if any. So it's my pleasure to give the floor to Ms. Natalia. Good afternoon, esteemed friends and colleagues. Today, we are discussing an extremely important issue for those who work with those dangerous diseases in Ukraine, with patients with dangerous diseases in Ukraine, and those who are very much concerned about the situation. Today, we can state that due to the partnership organizations which work in Ukraine, we clearly understand what's going on and what are the situation with the HIV/AIDS and tuberculosis patients who remain in the hostility area and in occupied Crimea, and this allows us to work and try to ensure that patients are not remained without support. Let's start with the situation in Donetsk and Luhansk Oblast. These were those very oblasts where we had the biggest number of HIV/AIDS patients before the conflict in the Donetsk region. 8,600 patients were supported on the account of the statements, and around 2,000 were supported from international organization of assistance to HIV/AIDS and malaria patients. In Luhansk Oblast, 2,300 were supported on the account of the Ukrainian state, and 400 more from the Worldwide Fund. And up to recent time, only 700 patients from Donetsk and Lugansk Oblast were registered in the mainland Ukraine. That is, out of that number, we have around 700 from Donetsk and up to 250 from Luhansk Oblast. Anyway, as far as we understand, 55% of patients remain in Luhansk Oblast and 54% in Donetsk Oblast. Also, we believe that 60% of HIV-infected patients should continue treatment in Donetsk, and 48% of HIV patients should be treated in Luhansk Oblast. As for the tuberculosis, unfortunately, in terms of this very disease, both those oblasts had huge numbers of patients registered with so-called sensitive tuberculosis, and big numbers of patients with so-called multi-resistant tuberculosis. And in Donetsk Oblast, now we have 48%, 47% with sensitive tuberculosis, and 350 patients, which is 44% of patients with multi-resistant tuberculosis. In Luhansk Oblast, there are now 67 patients, that is around 800 patients with sensitive tuberculosis, and 887, which amounts to 67% with multi-resistant tuberculosis. Due to coordination with and joint work with NGOs and international organizations, we managed to re-register departments of healthcare departments, and Oblast AIDS centers under new legal addresses. This allows us to resume supplies of necessary medicines to the occupied territories because the purchases last year were made for the entire territory of Ukraine. So our main objective today is to prevent any interruption in treatment of the patients who remain in the occupied territories, and also to provide them with those medicines which we receive and which are purchased by the state bodies and international organizations due to the weak situation, poor situation with medicines provisions in 2014. The healthcare bodies of Ukraine requested from international organizations to purchase additional drugs for those patients which should be treated both on the account of the state budget and on the account of the global fund. And the mechanism applied to urgent supplies or those medicines were purchased, and HIV patients and antiretroviral medicines were purchased, and the All-Ukrainian network of patients living with AIDS and HIV supplied those medicines to HIV patients. Similar approach was applied to the tuberculosis patients. Unfortunately, the procedure for getting temporary permit for entry to the country of tuberculosis medicines took some time, and now those medicines have been being supplied to occupied territories of Donetsk and Lugansk Oblast. The procedures of public procurement from the state budgets are completed now, and we have finished negotiations with the healthcare state departments which are located in the Ukrainian controlled territories in Donetsk and Lugansk Oblast, and now we're disseminating and supplying those medicines to those healthcare state borders. Currently, we're supplying them to Severodonetsk, and later they will be delivered to Slavyansk in line with the requesting letter received from Donetsk State Administration. As for the anti-tuberculosis drugs, from February 1st, we will start supplies to Donetsk and Lugansk Oblast. Currently, state healthcare bodies, together with vaccination inspection, are holding negotiations with the regional bodies, deciding on specific locations. Preliminary, there was an agreement that medicines will be delivered to Slavyansk, Mariupol, and Chervonoarmeysk. Unfortunately, today, after the terrorist attack in Mariupol, it's dangerous to bring those drugs there. As for the interruption of the therapy, we do not have registered cases of interrupted therapy process, and only 100 tuberculosis patients have removed to the controlled territory. Those who have changed their place of residence and stay in the controlled whole Ukrainian territory. They are under medical supervision, and we provide full care to them. Several days ago, the new issue arose about prevention of therapy interruption for 13 children who remain in Kramatorsk in a special orphanage, despite the fact that in Donetsk, currently, there is sufficient amount of drugs for those children, and they express their readiness to deliver those medicine. The bus which was delivering those medicine appeared unable to cross the border between occupied territories and mainland Ukraine, and unfortunately, it became impossible. So the drugs for those children will be delivered from Kharkiv Oblast state healthcare body. As for the Crimea,
yeah, we have to mention here to note here that starting from last summer, according to some of the establishments, some of the directions from June, sometimes from July, we actually did not receive any information or any, let's say, messages from Crimea regarding the patients suffering from the, let's say, the TB patients or AIDS and HIV patients regarding the supportive therapy. Well, just some of the organizations, according to the Global Fund and some of the international organizations, continue to support our efforts in order to prevention and support medicine. According to information available, the TB and HIV patients continue to get medications at the expense of the Russian Federation funds. Regarding those medical establishments which are situated on the territories not controlled by Ukraine, I would like to mention here that the Donetsk AIDS Center is very proactive in contacting us and tries to do everything possible to continue treatment of the patients. The Lugansk AIDS Center actually, in fact, stopped their giving the treatment because of the continuous bombardment. And again, if you're talking about some other medical establishments on the non-controlled by Ukraine territory, they refuse to continue the treatment. In the cooperation with those establishments, so it reports to, and we try to continue to make contacts with those establishments which are located on the controlled by Ukraine territory. Now I would like to give the floor to Mr. Oleksandr. Well, good afternoon to everybody. I'll try to be very brief. There's such a game puzzle. With my daughter, every day or every afternoon we play the puzzle game, and you, mass media people, are going to receive the information, which can be actually made adding some pieces of this mosaic puzzle. But again, if you're talking about the Kramatorsk people with the HIV positive, who were taken from a Kievka first, and now they are located in Kramatorsk. And again, if we're talking about the treatment of the children, it's in a critical situation now. We can be sure that the treatment can be continued only in the case when those medications will be directly sitting in Kramatorsk. At this point of time, there are no medications of that, or drugs required. In the Ukrainian AIDS Center, they actually try to help us to resolve this problem. They send it to Kharkov or Kazan, but if you're talking about the Kharkiv healthcare department at this level, those issues are kind of blocked and they're reluctant to do something about that. And speaking of Lugansk regional oblast, the situation available there, yesterday actually we received a letter from our office there in some of the sites in the territory controlled by Ukraine, antiviral therapy. We had enough medications. We still have till the January 30, till this coming Friday. Only owing to the fact that yesterday we started to be very much active in negotiations with vaccine. We hope that those badly required and badly need medications will be dispatched to Kharkiv Oblast, to Lugansk Oblast, I'm sorry. We have to understand that we are living under the conditions of war. And in such situation, we have to resolve faster. The old bureaucratic system does not allow us, does not permit to promptly respond to the requirements and the needs of the Donetsk and Lugansk Oblasts. Ukrvaccina organization, well, as far as I can remember, they all the time they try to invent or to table some kind of mythical, maybe not mythical, but anyway, some grounds not to bring the antiviral therapy, for example, to those regions. So try to resolve the problem and make it possible for those medications to be dispatched or sent to those oblasts. But at the Minister of Health, on their website, there was information that according to the instruction of the Prime Minister, the medications and drugs badly needed by Mariupol, the hospitals, the painkillers, and blood blocking, blood stopping, to make their dispatch or their delivery faster. Why you always have to push somebody in order to kick, of somebody in order to make it happen? A special situation in the state or public penitentiary service is a specific situation. Again, you can find this information in my specific piece of information. There are 34 penitentiary establishments in Donetsk and Lugansk Oblast. 8 of those are situated or located on territory controlled by Ukraine. The rest, they are kind of re-subordinated to the so-called DPR and LPR. This public penitentiary service, the central, the headquarters, actually cannot any longer continue to deliver the necessary food or drugs. More than that, for 2015, there is not a single item which is planned to be delivered to the HIV positive patients in those establishments in Donetsk and Lugansk Oblast. We actually purchased those drugs and medications at the cost of money available to us, and we'll try to do everything possible so those medications can reach those people who actually serve their sentences in those facilities, penitentiary facilities. We also try to work out the procedure how to deliver the necessary medications to the territories which are not controlled by Ukraine today. But unfortunately, this procedure, the draft procedure, was actually was submitted to the cabinet of ministers. For some reason, they actually put some hindrances in the way of its consideration. Pavlo maybe will tell more about that. So we have to address the government, some people, and say that in Donetsk and Lugansk Oblast, even on the territory which is not controlled by territory of Ukraine, there are some patients who on a daily basis require necessary treatment. And if we, if our state does not shoulder or does not bear the responsibility for promptly resolving those outstanding problems, this will lead to some global catastrophe. I don't know, I can't use the proper words how to describe that. Thank you. We have another representative from International Alliance. Good afternoon, dear colleagues. I'm going to be very laconic. Just kind of interlusion. I have kind of deja vu. 10 months ago, exactly here, together with the former head of the organization of those people who represent the people who live with HIV, who is now the advisor of the Minister of Health, we actually asked and requested to give us assistance in providing necessary help and assistance to the people in Crimea. You know that there are a lot of people who lost the possibility to be treated from their disease, mostly due to the Russian Federation's ban or prohibition to provide such help or assist those persons. And recently, Al Jazeera, News, Life News, Guardian, some other newspapers and magazines, every one out of 10 patients of this kind already are deceased or they actually died in the Crimea. We are talking about the Russian Federation authorities who occupied the Crimea. Now, after 10 months later, today, we are talking about almost 10,000 Ukrainian citizens who became hostages who reside on the uncontrolled by Ukraine territory. We are talking about the antiviral therapy, TB patients, etc., etc. Fortunately enough, I can actually say what Natalia Nikolaevna cannot talk about because she represents here the public authority and she is very much limited in her comments. We are an NGO, so we are not limited to that matter. We are here in the crisis center. We are talking about the humanitarian crisis in Donbass area. Alexander mentioned the scenario of the humanitarian catastrophe in Donbass, and indeed it's taking place now. I can say that the alliance, who is responsible for almost 8,000 patients with the substitution and supportive medicine, quite a big share of the population are covered by the specific medication. About 30% of those most sensitive or most vulnerable to HIV and AIDS, most of them live or reside on the non-controlled by Ukraine territory. And we can state that 400 patients of supportive and substitution therapy lost their medication in Lugansk and Donetsk Oblast because there were no medications delivered there. They lost this treatment or were deprived of this treatment not because of the interference of the Russian Federation occupation or whatever from Russia, but this happened because of the Minister of Health and the higher strata of the government of Ukraine. 4 months after this issue was raised about this bad situation in AIDS and their HIV sphere, the special decision was taken about delivering such necessary medication to those areas. We already are in the end, approaching the end of January, but that kind of instructions or the order is somewhere coming from one office to another, going between the offices, and nothing is being done. And if the proper decision be taken within 24 hours, we can deliver those badly required medications to those areas. So next week in Lugansk regional drug dispensary, 350 patients which require substitution and supportive medicine will be deprived of this treatment if we fail to deliver the necessary drugs, including among them methadone. Those who receive such a therapy, who used to lived on Netrophin, they again were deprived of this medication because this specific drug, this medical preparation was not delivered there, and because of the failure of some of the respective institutions to deliver those medications there. Today, there is much detail confined all the information about the number of the patients, number of the medical establishments, and geography of their location, and what already has happened, what can happen in the future, because today we are talking about more than 300, in addition to those 350 in Lugansk, who are going to lose or to be deprived of this medication, which is vitally important to them, if we fail to deliver their necessary drugs and medications till the end of February. And again, this will be the situation we have in Crimea. We are talking today that through the genocide of the Russian Federation in Crimea, many people who suffered from those diseases were on the substitution support medicine. They actually died or were deceased. And now we need the support on the part of the Ukrainian government, who must take care of the Ukrainian citizens living there. Nobody deprived them of the Ukrainian citizenship, and nobody submitted any kind of documents or to the respective organizations regarding let's say the discontinuation of delivery of those medication, because we are talking about the drugs and medicines purchased or procured through the budget public budget. Unfortunately, today we are witness the violation of the Geneva Convention regarding the insurance of the rights of the civil population in the days or in the time of war. And Geneva Conventions, they cover the situation not only the declared war, formally or legally, but in fact when we have some, let's say, war military confrontation or the warfare taking place. If within the next few days the respective minister or the government doesn't take the resolute steps and then does not outline the clear steps to involve the humanitarian international organizations to provide the chronic patients suffering from those diseases and who reside in the non-controlled by Ukraine territory, many of those people, as a result of this kind of reluctance or a failure to take any actions, will die, and the responsibility, the majority of the responsibility, will be at the door of the public authorities. That's why I approach and I address Prime Minister of Ukraine, the President of Ukraine, and I may tell you that the letter signed by 350 persons from Donbass were sent to the President of Ukraine, Prime Minister, in December last year, but there is no reply, no response. There are all the papers available. If you need the detailed information, you can find it on the website of International Alliance HIV and AIDS in Ukraine. Thank you very much for your attention.
Any questions, please? I have a question to Pavlo. How many people in total may be deprived from this antiviral treatment? And also I would like to confirm that those medicines are purchased not from the state budget, but from the humanitarian budget. 150 will stay without treatment from next week in Luhansk, and around 300, more than 300, will remain without treatment at the end of February in Donetsk. But I would like to clarify that we're speaking about narcotic drugs, and the circulation of those drugs is restricted, and you can find the documentation on the website on Healthcare Ministry dated from January 16 this year, which says that the procedure for delivery of this type of drugs onto the occupied territories is produced, but unfortunately, this procedure was not passed by the government, and it was sent back. It was sent back to the ministries for clarification. That is, we do not have any procedure for supplies of medicines into occupied territories, although Ukraine recognizes that there is around 10,000 patients with those chronic diseases which we mentioned earlier during our press briefing. There are no further questions. Thank you very much for your information, and we invite you in some week or two to explain